arrive for your personal evaluation, you'll be greeted at our front desk where we will check you in and ask you to fill out some simple forms. Our goal at Lipstock LASIK and Cataract Center is to make your experience as comfortable as possible. So please be sure and tell us of any needs or special attention you might desire. After you finish your forms, you'll meet with our refractive coordinator to discuss your specific vision limitations and your objectives. The coordinator will answer any questions or concerns you have and go over with you Dr. Lipstock's experience, the laser technology we use, and how he offers his patients an optional 20/20 money-back guarantee. She'll also go over with you all your financing options so you can easily make visual freedom a reality. You'll be surprised to hear how affordable LASIK really is when compared to the expensive glasses and contacts. For most people, the procedure costs less than a cup of coffee a day, and for most people, eliminates the cost of contacts, cleaning solutions, and glasses. The savings of those costs over a 10-year period will more than make up for the cost of LASIK. Once all your questions have been answered, one of our skilled technicians will take you back to one of the diagnostics rooms, where we will begin the exam. Your exam is important to precisely measure your vision and the health of your eyes to determine if you are a good candidate for laser vision correction. It is the #1 way that we assure safety for our patients, by making sure they are optimal candidates for LASIK in the first place. The first step is to diagnose the health and suitability of your eyes for laser vision correction. To do so, special diagnostic equipment is used. The first test is done on the orb scan. It's a quick and painless diagnostic test that analyzes and measures the thickness of the cornea. In order to have LASIK, the cornea must have enough tissue to allow for the creation of a thin flap and still allow for the removal of enough tissue to correct your refractive error. If the cornea is too thin or shows the early signs of progressive thinning of the cornea, then you might not be a good candidate for LASIK. The second test is performed on the Vuzix Wavescan Aberrometer. This test measures your complete optical system with the use of advanced wavefront technology. From this measurement, the surgeon receives highly detailed information of your prescription, and if there are other aberrations within your optical system that are causing light to scatter unevenly, which ultimately affect your quality of vision. These are all called high-order aberrations and are the errors responsible for glare and night vision problems. Using the information gathered from the Wavescan, Dr. Lipstock can now specifically customize every treatment for your unique eye, which results in improved night vision and more cases of better than 20/20 vision. After your corneal diagnosis determines your suitability for LASIK, we will then take you to one of our exam lanes, where one of our technicians will measure your current eyeglass prescription and begin taking a complete medical history of your eyes and eye health. This is extremely important, as this gives Dr. Lipstock an overall look at your eye health, as well as ensuring that there are no prior situations that could affect your procedure. We will also assess your occupational and lifestyle requirements, such as your work, recreational activities, or any other needs that may influence your vision correction strategies. We will then determine your current manifest refraction on the 4-opter. This is a manual refraction test for your eyes to determine your current prescription for LASIK. This examination gives Dr. Lipstock an excellent baseline of the current refractive state of your eyes and helps him prepare the optimum LASIK strategy for you. The final step in the exam process is for Dr. Lipstock to perform the last tests in order to ensure there are no reasons that you should not have laser vision correction. A slit lamp exam allows him to diagnose and monitor the health of your eyes, both inside and out, in order to help ensure that they are healthy enough for LASIK. Finally, once your suitability for LASIK is confirmed, we will go over with you your exam results and your personal requirements and expectations with the LASIK procedure, and together you will determine the best treatment plan for you. After your exams are completed, you will meet again with our refractive coordinator to discuss your evaluation, answer any final questions or concerns you have, and get you scheduled for your procedure. Your excitement will really begin to build from this point forward.
All the staff here treated me very kindly. They were open, friendly. I did not have to wait very long, which I think helped a lot. They care about you and are there for your well-being. Dr. Lipstock, like I said, has said calling morning, noon, and night. Any questions, any problems, any concerns, he's there.
Once you arrive on the day of your procedure, a technician will meet with you to get you prepared for surgery. Although LASIK is quick and a virtually painless procedure, we understand that our patients will still be a little nervous. So you'll be given the option of taking some medication that will help relax you if you choose. Afterwards, you'll be scrubbed and prepped for surgery. You'll be given some mild eye-numbing drops to help minimize any discomfort you may experience. When Dr. Lipstock is ready for surgery, you will be escorted into our LASIK suite, where you will sit in the chair in front of the lasers. LASIK involves 2 steps: the creation of the flap and the reshaping of the cornea. The first step involves creating and lifting a flap on the outer part of your cornea. So the second step of LASIK, the reshaping of your cornea with the excimer laser, can be performed. When the laser treatment is complete, the flap is repositioned into place. There are 2 ways the protective flap is created: a traditional handheld device called a microkeratome, or the blade-free intralase method. This femtosecond laser uses pulses of laser light to create the protective flap. This blade-free, computer-guided technology is 100% more accurate than most mechanical microkeratomes and provides unparalleled safety and visual results. The second part of the laser procedure, the reshaping of the cornea to correct your refractive error, is done with an excimer laser. Dr. Lipstock employs the Vuzix S4 with iris recognition. The Vuzix S4 IR, coupled with the intralase, creates the eye LASIK procedure, which is the most advanced laser platform available today. The benefits to the patients include reduced halos and glare and better night vision. This level of all laser precision and computer-controlled accuracy and customization is available only with the blade-free eye LASIK technology. In fact, it is this technology, coupled with the vast experience of Dr. Kenneth Lipstock, that allows the Lipstock LASIK and Cataract Center to offer a 20/20 or its free money-back guarantee. When the procedure is finished, you will sit up to look at the clock on the wall without glasses or contacts for the first time. Many patients are already thrilled with the immediate results. You are then escorted to the post-op area to rest for a while and receive your post-operative instructions. After you go home on the day of your procedure, you should take it easy by sleeping, resting. Most people can return to work and normal activities, including exercise, as early as the next day after LASIK. You may resume driving as soon as you are comfortable with your new vision. In fact, most everyone who has blade-free LASIK on Thursday can drive themselves to work on Monday. You'll be asked to return for your post-operative exam the next day after LASIK. This is a very important exam that ensures the health of your eyes after your procedure. You'll be seen by Dr. Lipstock, who will check your eyesight without glasses. Chances are, you'll be able to read the 20/20 vision line for the first time in years. The best news is that your eyesight will continue to get better over the next couple of months as your eyes continue to heal.